The BCG vaccine, which most Indians get when they are very young at birth, which is used to prevent tuberculosis, is now being given to healthcare workers. And the hope is that this, in many parts of the world, could actually become a way in which we can take on coronavirus. A new study which has been done by professors at Arthur Anderson Cancer Center, led by an Indian, Dr. Ashish Kama, the Mumbai-born person, suggests that BCG states which have ensured BCG immunization are less likely to have intense COVID virus. That's what is being suggested. Take a look at what our graphic says, and these graphics will tell you exactly why the BCG vaccine boosts immunity. Many believe this study, done over 178 countries, certainly suggests that the BCG vaccine could be a way forward.
So Rajdeep, this is a very interesting observation that we made. As you know, I'm a urologic oncologist and I treat mainly patients that have bladder cancer. And BCG has been used for bladder cancer for many decades. And we've observed that in patients who get BCG, there appears to be a boost in immunity, and that's how it works. It's an immunotherapy. So we were thinking about embarking on this clinical trial, and Mihai Nedia from the Netherlands contacted me through some of his trainees here in Houston and was thinking of doing this as a clinical trial in healthcare workers in US and Europe. And then we thought about looking at the actual data of incidence of COVID positive cases and correlating that with the BCG vaccination story. And the paper that you referenced was essentially done by one of my former trainees, Paul Hagerty, who is now a consultant urologist in the UK NHS system. And as you noted, what we found was that in countries that have an active or near active BCG vaccination program, there's a much lower, almost a tenfold lower incidence and mortality rate from COVID-19. And the thinking there is based on sound mechanistic rationale, because there have been numerous studies done over many, many years that show that BCG does improve immunity and response to infections, from Staph aureus to viral infections to influenza to yellow fever. So there's sound mechanistic rationale for that. There is this thought that having had BCG, either vaccination at birth or at a younger age, or even in elderly people, as is done in some nursing homes, does protect the person from any viral infection. And of course, COVID is a virus, a coronavirus, and hence BCG will induce a non-specific boost in the immune response to coronavirus as well. That's the thought process behind it. Point, and I always say you can't base recommendations just on observation. So absolutely, I would not recommend, or I would actually caution against getting complacent. We do need to wait and see what the study shows. We should have results hopefully in a short time. But if it does bear out that the BCG exposure does boost the immune response of a population in general, then that would be a really important piece of information for governments to know before they implement any policy changes.
BCG vaccination being given to corona health workers, or health workers taking care of corona patients, and in patients above the age of 60, to see whether it actually prevents coronavirus infections or actually decreases the severity of coronavirus infections. So I think we're looking at another exciting, perhaps, area, perhaps another drug which is already available to us and we have experience of using it. And these trials over the next 4 to 6 weeks, so these are not long trials, in 4 to 6 weeks, they will be able to tell us whether these drugs can actually prevent coronavirus infection or decrease the severity of coronavirus infection.
One of the effects of BCG, apart from its protective effect on tuberculosis, prevention of tuberculosis, is its basic increase in the immunity, the innate immunity of a human being, of a person who gets this. And this increase in the immunity actually enables the person who's been inoculated to fight infections. And it has been known, it has been seen that it has, it increases the immunity even for patients with virus infections, for bacterial infections. And this is actually what is being touted as something which is going to increase the immunity against the COVID-19 onslaught as of now. There is no definite evidence. There are studies. There is a study which is started in Melbourne in Australia, which is recruiting over 1,000 patients, 1,000 people, basically health workers who are working in a hospital in Melbourne, who have been injected with the BCG vaccine, and the results will be known in about 3 to 4 months, when we will be able to identify whether that is indeed helpful or not.